Over the last 2 decades, the widespread availability of high-speed internet and smartphones has dramatically increased access to online pornography. For many individuals, pornography use remains occasional and does not interfere with daily life, relationships, or sexual function. However, for a subset of users, pornography consumption becomes excessive, compulsive, or distressing. These individuals may report difficulty controlling use, guilt or shame, reduced sexual satisfaction, relationship problems, or concerns about erectile dysfunction, ED. This document provides a comprehensive, evidence-based discussion of pornography use, its potential psychological and physiological effects, its relationship with erectile dysfunction, recovery timelines, myths versus reality, treatment approaches, and possible implications for sexual health and fertility. Point 1. Is pornography addiction a medical diagnosis? Despite common usage of the term porn addiction, major psychiatric and medical organizations do not officially recognize pornography addiction as a standalone disorder. Instead, excessive or uncontrollable sexual behaviors, including pornography use, are often discussed under broader concepts such as compulsive sexual behavior or problematic sexual behavior. These terms emphasize functional impairment and distress rather than labeling the behavior as a substance-like addiction. This distinction is important because it influences treatment approaches, public perception, and self-blame. Lack of formal classification does not mean that suffering is not real. Rather, it reflects ongoing debate and limitations in current scientific evidence. Point 2. The brain, dopamine, and sexual conditioning. Pornography, like many pleasurable activities, activates the brain's reward system, particularly pathways involving dopamine. Dopamine is a neurotransmitter associated with motivation, learning, novelty, and reward prediction. Repeated exposure to highly stimulating sexual content may reinforce certain arousal patterns. Over time, some users report that they become more responsive to novelty, specific genres, or escalating content. This process is often described as sexual conditioning rather than brain damage. Importantly, current evidence does not demonstrate that pornography permanently alters the brain. Most studies are correlational and cannot prove cause and effect relationships. Psychological factors such as stress, anxiety, loneliness, and emotional regulation play major roles in how pornography is used and experienced. Point 3. Pornography and erectile dysfunction. Erectile dysfunction is defined as the persistent inability to achieve or maintain an erection sufficient for satisfactory sexual performance. ED is a multifactorial condition influenced by vascular health, hormones, neurological function, psychological state, and relational context. In recent years, researchers have explored whether frequent pornography use is associated with ED, particularly in younger men. Several observational studies and surveys have reported associations between high pornography consumption and self-reported erectile difficulties. Proposed mechanisms include performance anxiety, unrealistic expectations, conditioned arousal, and reduced sensitivity to partner-based stimulation. However, these studies do not prove that pornography directly causes ED. Many individuals who consume pornography regularly do not experience erectile problems. Conversely, many men with ED do not use pornography excessively. Point 4. Porn-induced erectile dysfunction, PIDE concept and controversy. The term porn-induced erectile dysfunction is commonly used in online communities and self-help forums. It describes a pattern where erections occur easily with pornography but are weak or absent during partnered sex. While many individuals report improvement after reducing or stopping pornography use, scientific consensus remains cautious. Most evidence supporting PIDE is anecdotal or based on self-reports. Nonetheless, clinicians acknowledge that conditioned arousal patterns and performance anxiety can meaningfully affect sexual function. Importantly, these patterns are often reversible with behavioral change, stress reduction, and therapy. Point 5. Recovery timeline. What people commonly experience recovery from problematic pornography use or porn-associated sexual difficulties varies widely. There is no universal timeline, and progress depends on physical health, mental health, relationship quality, and stress levels. Some individuals report an initial flatline period after reducing or stopping pornography, characterized by low libido or reduced sexual interest. This phase may last days to weeks and is thought to reflect psychological adjustment rather than physical harm. Over subsequent weeks to months, many report gradual return of spontaneous erections, improved arousal with partners, and reduced anxiety. Full recovery may take several months, particularly if underlying anxiety, depression, or relationship issues are present. 6. Medical evaluation and treatment. Any individual experiencing persistent erectile dysfunction should seek medical evaluation. ED can be an early sign of cardiovascular disease, diabetes, hormonal imbalance, or neurological conditions. Medical assessment may include blood tests, cardiovascular risk evaluation, and medication review. Phosphodiesterase 5 inhibitors, such as sildenafil or tadalafil, are commonly prescribed and can be highly effective. These medications improve erectile response but do not address underlying psychological or behavioral contributors. Therefore, medication is often most effective when combined with lifestyle and psychological interventions. 7. Psychological and behavioral treatment. Psychological approaches play a central role in addressing compulsive pornography use and associated sexual dysfunction. Cognitive behavioral therapy helps individuals identify triggers, challenge maladaptive beliefs, and develop healthier coping strategies. Sex therapy addresses performance anxiety, communication difficulties, and intimacy concerns. Mindfulness-based approaches may reduce compulsive urges and improve body awareness. For many individuals, therapy also addresses shame, guilt, and unrealistic expectations shaped by pornography. 8. Myths and misconceptions. There are many myths surrounding pornography and sexual health. One common myth is that pornography inevitably leads to addiction or erectile dysfunction. In reality, responses to pornography vary widely among individuals. Another myth is that quitting pornography guarantees instant recovery. Improvement is usually gradual and influenced by multiple factors. Finally, ED is often mistakenly attributed solely to low testosterone or physical failure, ignoring psychological contributors. 9. Pornography, sexual satisfaction, and relationships. Research suggests that heavy pornography use may be associated with lower sexual satisfaction for some individuals or couples. This may result from unrealistic expectations, reduced communication, or avoidance of intimacy. However, other studies show neutral or mixed effects, highlighting individual differences. Open communication between partners and shared understanding of expectations are critical protective factors. 10. Fertility and reproductive health. Current scientific evidence does not support the claim that pornography directly causes infertility. Some studies have explored associations between frequent masturbation, pornography use, hormone levels, and sperm parameters. Findings are inconsistent, and causation has not been established. Fertility is influenced by numerous factors including genetics, age, lifestyle, diet, sleep, stress, and environmental exposures. 11. Strategies to reduce problematic pornography use. Individuals seeking to reduce pornography use may benefit from identifying emotional and situational triggers. Limiting access through digital tools, developing alternative stress management strategies, engaging in physical activity, and improving sleep can be helpful. Seeking professional support is recommended when self-directed efforts are unsuccessful. Conclusion: pornography-related sexual concerns are complex, individualized, and influenced by biological, psychological, and social factors. There is no single explanation or solution that applies to everyone. Evidence-based approaches emphasize balanced understanding, avoidance of shame-based narratives, medical evaluation when appropriate, and psychological support. With appropriate intervention, most individuals experience significant improvement in sexual health and overall well-being. If you found this video helpful, don't forget to like, subscribe, and hit the bell icon so you never miss an update. We've got plenty more real talk on men's health coming your way. Thanks for watching, and we'll see you in the next video.